Hi everyone, our group made a presentation on complementary and alternative therapies for menopause. Complementary and alternative medicine is a group of diverse medical and healthcare practices, systems, or products that are not considered to be part of conventional medicine. Complementary medicine refers to therapies that are in addition to the traditional therapies, while alternative medicine refers to therapies that are in the place of other treatments. One of the main philosophies behind using CAM therapies is it often focuses on treating the patient as a whole, not just their physical health, but their spiritual and emotional health as well. A common approach with using CAM in conventional medicine is combining their benefits through what is called integrative medicine. Using both CAM and conventional medicine allows the consideration of all factors that influence health, wellness, and disease. There are 4 types of complementary and alternative medicines, and each category has evidence to support the use of CAMs to support women going through menopause. First one is mind-body medicine, which can include prayer, art, music, meditation, and dance therapies. 2 is biological-based practices, which include vitamins and herbal medicines. 3 is manipulative and body-based practices, including massage and chiropractic care. And finally, 4 is energy medicine, which involves energy fields, which includes therapeutic touch, Reiki, Qigong, and bioelectric magnetic-based therapies of sound, light, and magnet therapy. Menopausal symptoms can range from mild to severe, and CAM options can address several of those symptoms. Hormone replacement therapy, otherwise known as HRT, can be the right choice for some women, though they are not without some adverse effects. Having a provider that understands which CAM therapies can address menopausal symptoms can help some women avoid potentially risky and unnecessary medications. Interestingly enough, there was one study on the use of and attitudes of CAM. In that study, it was found that 51% of the interviewed women use CAM, and more than 60% of those women perceive it to be effective for the relief of menopausal symptoms. Menopause is often a difficult time for women due to the wide range of symptoms that may be experienced. Women often seek treatment for vasomotor symptoms, which include hot flashes, night sweats, flushing, and headaches. Other symptoms can include sleep disturbances, sexual dysfunction like vaginal dryness, mood disturbances, weight gain, and cognitive decline, including mild memory loss, verbal fluency impairment, and slowed psychomotor speed. Menopause is caused by the decrease in estrogen throughout the body that is often responsible for causing these sometimes debilitating symptoms. Starting off with mind-body medicine, cognitive behavioral therapy focuses on challenging and changing cognitive distortions and behaviors, improving emotional regulation, and the development of personal coping strategies that target solving current problems. In one study, it was found that women in menopause that used CBT had their hot flashes reduced by 52% compared to the no CBT group in that study. Yoga has shown some evidence in the short term to relieve psychological symptoms of menopause, yet no benefits have been found for the treatment of vasomotor symptoms. These hormone fluctuations during menopause can leave women struggling with depression and anxiety. Mindfulness and meditation can reduce those symptoms along with improving sleep and stress. Research is extensive on the benefits of Tai Chi. Tai Chi is an ancient Chinese practice that promotes a healthy mind, body, and spirit. Tai Chi reduces symptoms of menopause by improving psychological well-being, sleep, muscle strength, balance, bone mineral density, stress, and pain. Women who practiced Tai Chi consistently for 8 to 12 months showed a more significant effect. Guided imagery is a state of focused concentration and accessible mind-body relaxation therapy. This practice has decreased both stress and fatigue. 3 trials of hypnosis on women with a history of menopause-associated vasomotor symptoms showed a significant decrease in hot flash frequency compared to the no treatment group. Lavender essential oil decreases menopausal symptoms when used daily. One study of menopausal women found that lavender aroma, when it was smelled twice daily for 20 minutes, helped to decrease anxiety, depression, vasomotor symptoms, and improved sexual desire. Moving on to biologically based products, specifically herbs, black cohosh is very popular as an alternative or complementary therapy for menopause symptoms such as hot flashes, mood disturbances, diaphoresis, palpitations, and vaginal dryness. Several studies have found it to be helpful for up to 1 year. Chaste tree berry fruit can be used to treat vasomotor symptoms of menopause. There is not a lot of strong evidence for its efficacy, but it may provide some relief for some patients. It does have a few side effects worth mentioning, which include nausea, headache, GI disturbances, acne, itching, and a rash, but no drug interactions have been noted. Shatavari is an Ayurvedic treatment for vasomotor symptoms, including vaginal dryness and hormone balancing. Insomnia is a common complaint of menopausal women, and there are several herbal cam therapies to support sleep and relaxation. Passion flower can combat insomnia and ease anxiety. The dose for it is 1 to 3 milliliters every 2 to 3 hours before bed and every 3 to 6 hours during the day for anxiety. Also, chamomile promotes calm and sleep before bed in the form of tea or a tincture. Ginseng produces beneficial effects via stimulation of the hypothalamus pituitary adrenal axis. It is considered an aptogen. Clients should be encouraged to take ginseng in the morning since it can be stimulating and exacerbate sleep issues. Also, persons with diabetes should use caution due to the ability to induce hypoglycemia. In addition to herbs, vitamins have also been shown to be beneficial. A randomized control trial having women use either vaginal estrogen or vitamin E vaginal suppositories found that after 12 weeks of treatment with either intervention, there was improved vaginal atrophy in those menopausal women. Vitamin E suppositories could be an alternative option for women who are unable to use hormone therapy or have a low compliance with vaginal estrogen. Menopause is also associated with a progressive increase in total cholesterol. There is strong evidence that omega-3 fatty acids can significantly reduce those blood triglyceride levels. Hot sweats or night sweats are one of the most common menopause symptoms. It is unknown how acupuncture works to decrease menopause symptoms, but some studies have shown that this energy therapy can lower FSH and LH levels and increase estradiol levels. Several systematic reviews have found that acupuncture may be effective in reducing the frequency and intensity of hot flashes for these women. Reflexology involves pressure on reflex points that stimulate nerves and circulation related to body systems and organs to relieve discomfort or pain. One small study found that reflexology may help decrease depression in postmenopausal women. There was a significant decrease in depression scores in the women receiving reflexology compared to the control group. The main manipulative therapies are massage therapy, of which there are many subtypes, and chiropractic care. Other types of manipulative therapy would include craniosacral therapy or myofascial release, which some consider to be a subspecialty of chiropractic care. However, there was not a lot of data found on their use in menopause. There is not as much evidence to show that menopause is effective in reducing menopause symptoms, but some studies have found that it can be helpful in improving quality of life in menopausal women, as one study found that it is the most helpful CAM according to those women, while another found that craniofacial massage contributed to increased quality of life in menopausal women and also may aid with sleep. If chiropractic care is being used for menopausal symptoms, women are most likely using them for the treatment of sleep difficulty, tenseness, or pain. One article completed a literature review to see if there is any evidence for improved sleep after chiropractic care. While there is not any concrete evidence for chiropractic care improving sleep during menopause, it may increase comfort, which may contribute to better sleep for some of these women. Finally, homeopathy has been also studied and found effective to relieve menopausal symptoms. One observational study found that using the mentioned homeopathies in this slide in menopausal women, there was a significant reduction in the frequency of hot flashes and overall daily discomfort. In addition, 90% of the women in the study reported their symptoms to be lessened within 15 days of starting the homeopathy. These next couple slides just have all of our references. And that's the end of our presentation. Thanks everyone for watching. We are all looking forward to this week's discussion.